Hi, my name is Robert Lewis Hunter. I'm getting back to you today to talk about specifically Medicaid expansion and why it's important. I think it's important in part because we don't have infinite money. So what ends up happening is when I get sick or someone we know gets sick, a lot of times we don't have the ability to pay those medical bills out of pocket, so we have health insurance. For some people, like myself, who fall into the gap in between having enough money to apply for those insurances and having enough money to actually afford them, we have the Medicaid and the healthcare marketplace. And currently in Alabama, we do not have an expanded Medicaid system here. And it negatively affects our ability to make these type of decisions when it comes to how, as a community, we can make sure that our community members are healthy. That's really important, in part because it's frustrating when there's only 3 hospitals within an hour of where you live. And there's a chance within the next 5 to 6 years, there'll be none. Just because at the end of the day, the hospitals need funding to make sure they're able to stay afloat. And we're losing anywhere from $10 million to $100 million every single year just off of us not expanding it. Because what ends up happening is we pay about 1 to 5% of the cost. The federal government picks up the other 90+%. It's important to notate that because that is hundreds of millions of dollars of federal aid not coming here when it is desperately needed. Because I don't know that many people in my life, particularly that can just say flippantly, I'm gonna go get heart surgery real quick. I could pay for it out of pocket, of course. Do you? Again, it's not very often we find those community members. And if they are in existence, they already have their own health care, normally through their job. So I'm fighting to make sure that we do more for just those who already have the resources. We help people that are in need. And that's why I'm pushing for Medicaid expansion.